If you have been waiting for the power of Ozempic or Wegovy in a pill, the wait is over. No more needles and no more weekly shots, as the FDA has officially approved the Wegovy pill. Hi, and if you're new here, I'm Dr. Bazgha Khalid, and today I'm talking about a massive shift in how we treat weight loss. For years, my patients have asked me, Doctor, do I have to do the needles? Up until now, for the most powerful medications, the answer was yes. But as of December 22nd, 2025, the FDA has officially approved the Wegovy pill, the first ever high dose oral GLP-1 medication specifically for weight loss. Today, I'm breaking down everything you need to know: the science, the results, the cost, and whether you should switch from the shot to the pill. Let's dive in. So, what is the Wegovy pill and how it works? So, what exactly is it? The Wegovy pill is a 25 milligram daily tablet of semaglutide. You might recognize that name. It's the same active ingredient in the Wegovy and the Ozempic injections. How does the Wegovy pill actually work? Think of it like a fullness thermostat. It mimics a natural hormone in your gut called GLP-1 or glucagon-like peptide 1. When you take the pill, it does three things. The brain, it tells your brain you are full so that you stop thinking about food. We call this quieting the food noise. Secondly, the stomach, it slows down how fast your stomach empties so that small meal stays with you longer. Third, the insulin, it helps your body manage blood sugar more efficiently. Basically, it's a daily reset for your appetite. So, what do clinical studies show? Does Wegovy pill actually work? Now, the big question is Wegovy pill as strong as the Wegovy shot? The FDA approval was based on the OASIS 4 trial. In this study, people taking the 25 milligram of Wegovy pill lost an average of 16.6% of their body weight over 64 weeks. To put that in perspective, if you weigh 250 pounds, that's about 41 pounds lost. 1 in 3 people in the study lost 20% or more of their body weight. That is almost identical to what we see with a 2.4 milligram Wegovy injection. So the short answer is yes, the Wegovy pill is a weight loss contender. How about oral versus injection? Which is better? Let's compare the two. The injection, you do it once a week, it's easy to remember, and it bypasses the stomach, which is great if you have a sensitive GI tract. The pill, you take it every single day, no needles and no refrigeration needed, which is a huge plus for travelers or those who prefer an oral option. The catch, the pill is picky. Because semaglutide is a big molecule, it's hard for the stomach to absorb. You have to take Wegovy pill on an empty stomach with no more than 4 ounces of plain water and wait 30 minutes before eating or drinking anything else. If you drink a giant cup of coffee right after the pill, it won't work. Let's talk about the Wegovy pill dosing schedule. The Wegovy pill follows a 30-day escalation cycle. The recommendation is not to jumpstart to the 25 milligram dose. Rather, start at the lowest dose and then must climb the ladder to allow your digestive system to adapt. Starting dose of Wegovy pill is 1.5 milligram. You stay on this dose for at least a month. This will help your body get used to the medicine. And then move to the next dose, which is 4 milligram for a month. And then up titrate to 9 milligram dose, which is the next dose, and stay on it for another month or maybe longer. And then up titrate to the highest dose of 25 milligram as tolerated. Wegovy 25 milligram is the full therapeutic dose. Recommendation is to stay on one dose for at least a month. Consider staying longer and doing a rather slow up titration if you experience stomach upset or side effects. So what are Wegovy pill myths versus facts? Let's clear up some rumors. Myth is the pill has fewer side effects. However, the fact is because it's the same drug, you can still expect some nausea, especially when you first start the medication. Another myth is I can just switch my Rybelsus for this. Fact is, Rybelsus is the diabetes version, usually 7 milligram or 15 milligram dose. However, the Wegovy pill is a much higher dose of 25 milligram, specifically tuned for weight loss. How about Wegovy Pill side effects? As a doctor, patient safety comes first. The recently approved Wegovy Pill carries the same safety profile as the injection because it is the same active ingredient. Let's be honest, your body is going to feel this medication, especially when you first start. Because the Wegovy Pill is the same active ingredient as the shot, it comes with similar adjustment symptoms. About 44% of people in Wegovy pill trials reported some nausea. The most common big four side effects are: number one, nausea usually happens right after you step up to a higher dose. Number two, diarrhea or constipation. Your gut is relearning how to process food at a slower speed. Number three, stomach pain and bloating. That too full feeling even after a few bites. Number four, fatigue. You might feel a bit wiped out in the first few weeks as your calorie intake drops. Good news is that most of these side effects are mild to moderate and fade away within a few weeks. If you're nauseous, try small, bland meals and stay well hydrated. How about serious side effects? While the common side effects are manageable, there are a few red flags where you need to stop the medication and call your doctor. These are pancreatitis. This is inflammation of the pancreas. Watch for severe stomach pain that radiates to your back and won't go away. Or gallbladder issues. If you feel sharp pain in your upper right abdomen or notice yellowing of your eyes, jaundice, it could be gallstones. Kidney problems. Severe vomiting or diarrhea can lead to dehydration, which is tough on the kidneys. Keep drinking your water. Vision changes, especially for those with type 2 diabetes. Semaglutide can sometimes worsen diabetic retinopathy. Mental health. Pay attention to your mood. If you feel new or worsening depression or thoughts of self harm, your doctor needs to know that right away. Let's talk about the black box warning. You'll see a black box warning on the packaging for the Wegovy pill. This is the FDA's most serious alert. It's regarding a specific type of thyroid cancer called medullary thyroid carcinoma. In animal studies, specifically rodent studies, semaglutide shows slight risk for causing these tumors. We don't know yet if this can happen in humans, but we don't take risks, and therefore you'll see and hear about this FDA black box warning for all GLP-1 medications, including Wegovy pill. So, who should not take the Wegovy pill? Anyone with a personal or family history of medullary thyroid cancer, anyone with multiple endocrine neoplasia syndrome type 2. This is a cluster of tumors involving thyroid, parathyroid, and adrenal glands. If you have a history of irregular thyroid nodules or hyper or hypothyroidism, you are usually fine, but always tell your doctor about your full family history. What is special 2025-2026 warning regarding surgery? One new safety update is if you have a scheduled surgery, you must tell your surgeon you are on the Wegovy pill or injection. Because these medications slow down your stomach, there is a risk for food staying in your system too long, which can cause serious complications under anesthesia. Most doctors will ask you to stop the pill for a week or more before any procedure. How about cost and how to get it? Now for the part everyone would like to know, the Wegovy pill price. The Wegovy pill is launching in early January 2026. The manufacturer is aiming for this to be their most accessible version yet. Through programs like Trump RX and new direct-to-consumer platforms, the starting dose could be as low as $149 per month for self-pay for the starting dose. Prices may be higher for higher doses. If you have Medicare or Medicaid, the landscape is changing too. New 2026 guidelines are opening doors for coverage if you have a BMI over 30 or a BMI over 27 with a heart condition. So, what questions should you be asking your doctor before you leave your doctor's office with a prescription for the Wegovy pill? You need to make sure this is the right tool for your health needs. Not every weight loss journey is the same. Here are the top 5 questions I want you to consider asking your doctor. Is my gut health ready for a daily pill. Because you take this pill every day, unlike the shot, which is once a week, it is constantly interacting with your stomach lining. If you have a history of gastroparesis or slow stomach emptying or severe GERD or acid reflux, the pill might worsen those symptoms more than the injection would, and therefore best to discuss with your doctor first. How will Wegovy pill affect my other morning medications? This may be the most critical question for many of you. Because the Wegovy pill requires a 30-minute fasting window, it can change how your body absorbs other important medications like your thyroid medications or levothyroxine or blood pressure medications. You may need to move your other medication schedule to make sure they still work properly, and therefore best to discuss with your doctor. What is the plan if I can't tolerate the dose increase? The titration schedule is month 1, 1.5 milligram dose, month 2, 4 milligram, and so on. But what if month 2 makes you too nauseous to function? Ask your doctor. Can we stay at the lower dose for an extra month? Most doctors are happy to go slower to keep you comfortable. Do I have any red flag conditions in my family history? What is our long-term goal and exit strategy? Is this a medication you'll stay for a year or 2 years or for life? Ask your doctor how you'll define success and what the plan is once you reach your goal weight. The Wegovy pill is a massive breakthrough for weight management. It is opening doors for people who travel, people who don't like needles, and people who just want a simple daily routine. But remember, it's just one piece of the puzzle. You still need the protein, the water, the movement to see those 16% weight loss results I talked about. I want to hear from you. If you had the choice today, would you pick the once a week shot or once a day pill? Drop a comment below and let's start a conversation. If you found this video helpful, hit that subscribe button. I'm here to keep you updated on the latest in medical weight loss so you can make the best decision for your health. Until next time, stay happy, healthy, and well. Bye for now.